I think that's super interesting how you're pulling together data from all these disparate sources, as you mentioned, getting a holistic picture, and you can utilize that to run these simulations. Do you mind talking about the data that you're pulling together, what you're seeing in terms of trends?
Again, so this modeling is just so much faster and so much more readily available. So there's that aspect. And then, of course, the costs. Employers are suffering with these trends. Everybody talks about this 9.5% trend that we project for 2026, but in reality, that's on the heels of 7.5%, 8% trend that we experienced last year. And they're like, oh, thank goodness we got through that hurdle. Well, the headwinds are like, there's more hurdles to face. And the reality is that most of the time it's a lot larger than 9.5% for certain people because they've had a ton of high cost claimants. They have, big claims in cancer, MSK. They've got gene and cell therapies that are just multi-million-dollar type of claims. They got the specialty pharma issue that is continuing to proliferate. They've got the decision on GLP-1s. So we're seeing a lot of employers suffering with this high-cost claim issue. And then also that means that there's stop loss if they have stop loss. And hopefully they've evaluated that really readily.
Welcome to Spark Spotlight. I'm your host, Lindsay Kratzer, CEO of Spark Health Advisors, where we help healthcare companies successfully navigate and accelerate in the employer and payer markets. On this podcast, we talk specifically about what it takes to sell into employers and health plans. I sit down with founders, executives, and industry leaders to unpack what's working, what's not, and how to win in these complex sales environments. On our topic for today, we are going to chat about workforce optimization. Mercer has been doing a ton of work in this area and really has been thinking through a lot around how optimizing your workforce plays out into impacting benefit strategy and total reward strategy for many of the employers that I know a lot of us are always working to target and sell into. Wendy has fantastic experience working with some of the largest employers, knows a lot about what's on their mind, and has been working through these workforce optimization strategies with those groups. So welcome, Wendy.
Thanks so much, Lindsay. I really appreciate the time and always good to talk with you. I'll give just a little bit of snippet of more background of mine because I worked in the health insurance space for about 18 to 20 years. That definitely helped inform me from that perspective. Then I worked in health systems for a few years running employee populations and plans for health systems. And then I made my way to consulting. I worked for another consulting firm for 7 years as a national practice leader, being the front door to the innovative disruptors and really helping unpack that for the consultants. And then I joined Mercer and partner level based in Austin, Texas. The work that I'm doing today is some lead consultant work, some strategic advisory work, and also just, prospecting and retention efforts across multiple employers across the country. So it's really a great space, and the work that Mercer's doing in this space is really intriguing to me. I feel like we make a lot of assumptions, Lindsay, about what we know about our workforce, right? We have employee surveys, we have different data sets, but these are kind of disparate data sets. And so what we're really bringing together is combination of like retirement information, payroll information, claims data on your benefits, all the different data sets that we have are integral to each other. So we truly understand what's going on. So that's one aspect of this workforce optimization. And then another aspect of it is with AI, we actually have an ability to help employers truly understand capacity within job roles. Job architecture plus capacity is kind of how I think about it. In health systems, for example, we always think that there's a nursing shortage, for example. But because of this work that we're doing, we look at it from a geographic perspective, and in some geographies, there's not a nursing shortage. We find that there's actually, even sometimes they have too many nurses. They might be over-optimizing. So they're not maximizing, they're over-optimizing. Meaning that if you look at it at a job level, a task level, they sometimes then realize that they can build capacity into those roles. And so a lot of what we're doing is this digital twinning, where we look at lots and lots of simulations that can be done with AI very readily, and it helps get to the answer. What can we automate? What can we standardize? What can we centralize? And sometimes when there's too many of one job let's say job architecture, then people are running all over each other and it's not satisfactory to them. They're not making the impact that they wanted to make and they're not finding that fit. And so this is really where it's fascinating to be able to run hundreds of simulations very, very readily. And then you don't even have to pilot. You like, okay, we've run all these simulations. Let's look at these top five, and then let's unpack those top five, and then let's get to the answer, and not even have to like waste another 6 months of piloting this stuff. All this stuff matters so, so much to what we were talking about as the total rewards and the benefits, because let's face it, that's where you're spending the money. You're spending the money in labor and you're spending the money in benefits.
Absolutely. Yeah. I mean, benefits is typically like the second largest cost driver for most employers after labor. So I think that's super interesting how you're pulling together data from all these disparate sources, as you mentioned, and then getting a holistic picture, and you can utilize that to run these simulations. Do you mind talking a little bit about the data that you're pulling together, what you're seeing in terms of trends that are hitting large employers or employers more holistically?
Yeah, let me start by saying, we're also looking at this. Mercer does a lot of benchmarking within a vertical. And sometimes that verticalization is really important. And I hear employers talk about this all the time. Like they want to benchmark against themselves, let's say in manufacturing. But in manufacturing, we're also seeing, particularly in like automotive, there's a trend, absolute trend, that they're moving more into like a tech reality. So it's really important for them to measure both the manufacturing vertical and the tech vertical and benchmark against that. So we're seeing a lot of that ask. And so again, this data is super important because you can look at it across all employers, you can look at it across a vertical, you can look at it in terms of a vertical and the geography of the vertical. So it really helps to set the stage very readily. And luckily, with the structure and the platforms that we're utilizing in the data science that we're using, it's really easy to do this. It's not like it used to be where it would take weeks. I have to go back and crunch the numbers and come back again and again and again. So this modeling is just so much faster and so much more readily available. So there's that aspect. And then, of course, the cost. Employers are suffering with these trends. Everybody talks about this 9.5% trend that we project for 2026. But in reality, that's on the heels of a 7.5%, 8% trend that we experienced last year. And they're like, oh, thank goodness we got through that hurdle. Well, the headwinds are like, there's more hurdles to face. And the reality is that most of the time it's a lot larger than 9.5% for certain people because they've had a ton of high cost claimants. They have big claims in cancer, MSK. They've got gene and cell therapies that are just multi-million-dollar type of claims. They got the specialty pharma issue that is continuing to proliferate. They've got the decision on GLP-1s. So we're seeing a lot of employers suffering with this high-cost claim issue. And then also, that means that their stop loss, if they have stop loss, and hopefully they've evaluated that really readily, their stop loss has been not performing well, let's put it that way, to the point where we're seeing employers want to go out to bid on their stop loss. And we look at that, we bid it out. We might bid it out to, let's say, 10 different carriers. And what we're finding over and over is because their stop loss performance was so bad, they actually they got a decline to quote with 9 out of the 10. The only people that were willing to quote was the incumbent.
Wow. Whoa, that's crazy. That's absolutely crazy. So, yeah, we've had a lot of conversations on this podcast and in my day-to-day work around what employers are doing because of these cost increases. You mentioned a number of the different conditions and drivers of the cost increases, like the specialty pharmacy or GLP-1s. I've heard a lot of different, strategies in terms of what employers are looking at to kind of get around, some of the cost trends. I think, going out to bid for stop loss is something that's really interesting. Have you heard, are there other innovative strategies that you are seeing kind of across the Mercer book of business that you guys are maybe recommending to a larger number of clients as they're looking to kind of get ahead of this cost trend or, to really kind of bring it down going into 2027?
Absolutely. I mean, there's a philosophy that I keep hearing. And I even keep seeing it on LinkedIn and other places. And we've had certain CEOs that have absolutely leaned into this much more than they ever have in the past because they feel like they have to. It's becoming a consuming entity of their revenue. So Employers are saying, we've got to uncover every rock. We've got to turn it over. We've got to look again. Maybe we thought about things like reference-based pricing in the past and we passed on it because it felt too disruptive. But now, as we look at our trend and we look at our realities, and sometimes even about giving something that's more affordable to a lower wage earner, for example, what is something that we can add in that's going to bring that to reality? So they have to look at it again. So reference-based pricing is absolutely more on the table than I've ever seen it before. I've been a fan of reference-based pricing for a long time. I see the math is so simple. You're basically taking the contractual that a carrier negotiates, which is somewhere in the neighborhood for hospitals at 250% of Medicare is the average payment. And you're moving that to a percentage of Medicare somewhere in the neighborhood of 140 to 150%. So I know you understand that, but I want to make sure our audience understands that as well. Like that's the differential, and it's big. Are there some pain points within that? Yes, that have to be discussed, communicated effectively. So reference-based pricing, continuation of the surgical networks and how that can align nicely with carriers. The carriers are also creating their own health hubs where they have an offering to say, okay, we're going to offer an ability for you to add the surgical network with a one-page agreement to your ASO arrangement. That makes it simple. You don't have to go back through procurement. It's just the time on task is less. There's some off-cycle capabilities in that type of arena that I think are also impactful because, let's face it, the open enrollment period is so condensed and so chock full of information. Sometimes doing an off-cycle offering is a good thing. We're looking at advanced primary care, and direct primary care is another avenue here that, makes sense. You have a very critical relationship with your primary care physician that helps set the stage for the rest of the story, and also that a lot of that care is being taken care of at that primary care level. So maybe your specialty costs go down to some degree, and then you're also looking at things like cost and quality data that can be applied on top of any carrier or any directive so that you know who are the best performers out there and how do we engage our employees to know that and to utilize the best outcome performer so that impacts the total cost of care as well. So I just said a lot there, but those are kind of the things that people are really diving into, and we're helping them. I like to call them the big rocks. That's where you're going to get the most savings and most impact. All the benefits, fertility, etc. Those are important, and it helps from a retention standpoint, but you're not going to get a lot of cost savings there.
Yeah, that makes sense. I love that you called out primary care. As you know, I came from the primary care space, so big believer in the ability of primary care to move the needle. We also have a lot of clients that are working on kind of breaking into the carrier's health hubs, so I think that's a great call out. When we were doing the lead up, we talked a little bit about pharmacy. We talked about specialty pharmacy and GLP-1 costs. Curious, what you're seeing in terms of cost trends strategies to bring down the cost trend for pharmacy. We hear a lot about transparent PBMs or, companies looking to move to a different PBM and kind of rethink that landscape. Curious what you're seeing across your book of business there.
Yeah, the PBM space is on fire. You got your big four that have been the traditional PBMs, and they still maintain a very high percentage of the PBM work. However, I think there is definitely an appetite, much like you're seeing in the medical that we were just talking about and all the proliferation of other alternatives. The same thing exists in PBM space. And so we're seeing this transparent PBM and some of even the niche PBMs that are maybe offering a lead into GLP-1 specifically to bend the trend, if you will. We are certainly seeing the GLP-1 space change dramatically. We've got pill form now. We've got the price points that are coming down we've got the semaglutide component where you can get it at an outside pharmacy. So we've seen this whole dynamic of GLP-1s, but it's still absolutely a place where employers want to think and really unpack. Can we afford it outside of diabetic coverage? Should we afford it? Are we going to be able to then look at the rebate dynamics of the major four PBMs and what's going on there? There's been a lot of change of contract in the four big ones in terms of like their guarantees and things that they're willing to commit to and let's say, believe in and stay true to. And so I feel like the PBM space is going to continue. I think we're going to see maybe this traditional PBM keeping, continue to keep a large percentage of what they own today. But I think there's going to be alongside transparent PBMs, and it may be niched out. So we're just going to see that landscape continue to change. But I do feel like that the carriers that own the four big PBMs, they're also saying we want to retain both medical and pharma. And so they're making some concessions that kind of blend the two in order to keep both sides of that. So that's a little bit of the dynamic that exists right now.
I mean, it's really interesting. While it's obviously terrible that the cost trend has been going up in this way, it has forced a lot of change. I feel like a lot of companies that maybe, historically might have sat on the sidelines and said, well, we are going to keep doing the same strategies we have always done to manage this, are having to take a look at, different things. And it's also allowing a lot of more innovative solutions, ways of solving the problem to bubble up. So, I mean, in a way, it's forcing some good things, but obviously the numbers are staggering and very hard for everybody to absorb.
The actuaries are pretty busy right now in that
exactly.
space because it really is a math exercise. What is the rebate game on the traditional end, and what is the transparency game? And how do we evaluate the two and really get to the end answer?
Yeah, absolutely. Absolutely. We've talked a bit about cost. I was curious on retention. You mentioned that earlier. I think that there is a bit of the perception that because cost is number one to employers right now, that employee retention and those strategies are going by the sidelines and employers don't care about them as much. I would think, based on what you were saying, how you guys are looking at trends based on geography or the vertical that an employer is working in, that it looks very different, depending on the workforces that you're engaging with, and what they're needing to do to either compete for talent or retain their talent. Obviously, we're seeing a lot of news around layoffs right now, but would be curious about what role the retention piece is playing in benefit strategy with the employers that you work with, and how that differs across the different populations that you are seeing and working with across Mercer as you're thinking about the data for those specific organizations.
Yeah, I think retention is still very viable. We see, so I'll talk about manufacturing for a minute. So we have a few clients that are in things like forestry and other aspects of manufacturing, and they're seeing like their continual trend is like 40% turnover every year. Sometimes that's just the reality, right? They might get attracted to another job for a little bit higher wage, or English as a second language is a part of that. Then they've just got all these different issues that they're dealing with. But retention is still high on their list, but I think they also just realize within their industry there's just some realities of trends that they're not going to necessarily change. Then you've got something like healthcare, where retention is so high on the list because we know going and finding that nurse or that NP or that medical assistant is difficult. So we want to try to retain, and it's a high female population. Things like fertility and women's health are really a big part of where they want to focus, because that's table stakes. So there's the reality of table stakes, and then there's the reality of cost. And so it's both that have to play against each other. But I feel like certainly there's, in the women's health space, there's a lot of things that can be added, and it's not that expensive, and it's also so important to retain. So there's just going to be focal points. I'm not saying that every industry is dramatically different, but there are nuances within every vertical that are going to matter a little bit. Tech, certainly we know that the tech retention is super high. We want to keep those engineers happy, and we want to keep their families happy. And so how do we look at all of that? It's not just the employee, it's also the family piece. Certainly we also know that there's the reality that employers would prefer that if it's the wife of the engineer, for example, and it's a male engineer, and the wife has another job, then from a benefit perspective, we would prefer for them to choose their employer benefit instead of jumping on the maybe richer benefits that they're going to get from a tech firm.
Yes. Yeah. That's always a huge challenge. How are you seeing those organizations navigate that, without disincentivizing or frustrating their employees that work for them full time?
Yeah, there's definitely continued evaluation of the family coverage or the spouse coverage. And then there's even some additional premiums that are being applied in that space. So we're seeing that as a pretty active space. Pretty much year over year, employers want, at least every 2 or 3 years, they want to reevaluate that to see how their numbers are looking. And then again, how they're benchmarking across the space.
I love how you mentioned table stakes benefits as well. I agree. It seems like, since there have been so many interesting new solutions that have come to market, even talking about women's health, it's a very broad category, whereas, historically people might have thought fertility and now it's broadened into like really kind of the full life cycle of a woman. I think that I totally agree that the table stakes in terms of the benefits offerings, has risen, and that bar has been risen for organizations. Are there different trends that you're seeing in terms of solutions that are being most in demand right now going into 2026, 2027?
I think there's the demand issue, and I think that that's also really spurring a lot of the aggregation. So I think we're going to see in 2026 and 2027 a lot of aggregation. So we're already kind of seeing it if you look at Sword and Kaya, just as one example,
Yes.
to call out from last week. If you look at the women's health space, how do we look at fertility, but how do we also look at menopause, premenopause? How do we look at, you know, all of the components of women's health and stack those so that it's one offering? We know that when it comes to the vendor space, the reality is the game is utilization. We've gone from a PEPM model to more of a percentage of savings model in a lot of those spaces, but at the end of the day, what employers continue to be a little bit frustrated with is we have these offerings and people are not engaging, they're not utilizing them. So that gets into the realities of how do we communicate these things and what's the most effective way to communicate them. And that's that's the mystery still. I wish I had that answer. I would be far better consultant if I had that answer. But I've read a lot about this and seen different people comment on it, even in the last week. And using effective communication where it's a mailer going to their home, how do we look at the envelope that it's in? How do we look at how it's communicated? How do we look at it in terms of English as a second language, possibly, because there's such a reality in our demographics and ethnicity. So how do we take all of those things and make it into an effective communication that has to be multimodal? But there's a lot of talk around going back to the mailer, and that's something that they tangibly get. If they don't speak English, somebody can possibly translate it for them. It's written in such a way that then they can take that, remember it, hold on to it, come to work, talk to someone about it, all those things. So it's almost that tangibility, because everything now we have is digital, or we don't have a piece of paper that we hold on to any longer. So it seems like old school is new school to some degree in that space.
That's funny. Yeah, I mean, also if like their spouse is the decision maker around healthcare benefit, or around healthcare and what they're utilizing, and that person that's really coordinating the care from the family perspective, and they're at home, how do you actually reach them effectively? And that's where mailers can be super, super helpful. That makes a lot of sense. In terms of talking a bit about aggregation, we speak with a lot of different point solutions because of the type of work that we do. And the message that we historically and typically tell those groups is that employers are interested in innovation. To your point, Wendy, like on even the women's health piece, there's all of these different types of solutions that play into kind of a women's healthcare benefit. But the employer typically wants to work directly with one of those organizations, or to buy it in a way that makes sense to them, and then they want it all integrated into their ecosystem so that it feels like a more comprehensive, to your point, like stacked benefit for the employee, and then it's also easier to communicate. So just curious if there's anything else you'd like to elaborate on that topic. I think that that's really important in terms of the trend and where things are moving, because again, I think there's a lot of innovation out there. I think that's great, but you have to think about the realities of how it's actually going to get utilized.
Right. I mean, we've seen things like a navigator plus a MSK virtual solution plus a surgical solution align and partner effectively. I think, we're going to see that in a lot of different areas. And I feel like there's also continued room for this front door, whether it's your benefits enrollment that has navigation and alignment with different partnerships. All of that space is really in play right now. I think it's really emerging. I think we're going to see a lot of transition in that space, which is going to be a good thing, because the more that we can align these things and make it one front door, the more likely that we can communicate effectively to say, just use this one front door. How do we get there? That's the challenge. But if you think about the time that we've had disruptive innovators, it hasn't really, I mean, we've had them forever, but the proliferation of them has really just been in the last 7 to 10 years. And so we've made a lot of headway. Now we just have to kind of retread some of that and say, how do we make it better in terms of communication and utilization? And I really feel like that's the space that we're in right now, is in terms of the evolution of how effective these things can be.
For sure, for sure. I think that makes sense. One topic that we've been talking to different, clients of ours, prospects, other people in the market about is accountability as well. So, since there have been so many new point solutions, we talked about how you aggregate those and put those into the employer's ecosystem to drive that utilization, the communication. You talked about kind of this switch from pricing that's more of a PEPM model to either like a pay by the drink or a percentage of savings model. Anything else that you might say on accountability from a vendor's perspective, or maybe from the employer's perspective, how they're thinking about holding all of these different solutions that they work with accountable? Because we're seeing that being just kind of an increasing trend, as especially employers absorbing these crazy high cost increases. They're putting more pressure, obviously, on all of their vendor partners and taking solutions out to RFP, like you mentioned. But just curious if there's anything else you'd like to say on that.
Yeah, I think that kind of back to that turning over every rock mentality, employers have to get realistic about the fact of how they communicate and how they become to use their data to then help predict as well as communicate with different niche populations. We can no longer think that just a mailer is going to work, or just an open enrollment packet's going to work. So that proliferation of using the data to allow your vendor or your partner, because you have truly partnered with them to address the problem, how you can use that and allow them to use that and allow them to communicate in different ways. Reach outs, more defined reach outs of population sets is really where I think this has to continue to go, and allowing vendors to do their job. They want to do it. It's just been, employers have been a little hesitant. I understand that. I understand why. But it's really important for us to all get on the same page as it relates to the communication dynamics and how we use the data to inform it, and then how we use whether it's a navigator or the vendor themselves, to go after those populations to say, did you know that you have this benefit? Did you know why you have this benefit? Do you know how to utilize this benefit? So it's really just getting more and more specific with the populations that exist, so that we can really start to solve the problem and we can start to see a little bit of the bend.
Yeah, for sure. I mean, because how are these vendors going to drive any outcomes if, they can't get people to utilize the solution in the first place? So, I mean, great idea, but it comes down to the execution oftentimes. And if they're not able to execute because of some of these different barriers, then it's very challenging for everyone. You talked a little bit earlier around data, but then you were talking about AI and some of the simulations that you guys are running. That sounds like a really interesting topic. Would love to hear a little bit more about that, and maybe an example, and perhaps how that might impact the benefit side of the house or HR. I think that a lot of people are always interested in what are the broader things that are on the minds of these HR leaders, sometimes even outside of benefits, as they're trying to work with employers.
Yeah, I'll talk a little bit about the simulation. So one example that pops to mind is with the health system that we work with, and they had to shut down like 7 of their ambulatory clinics because they couldn't find MAs to staff it. They had a shortage in that area. So we did this look at that job specifically, in that setting specifically, got the right people in the room, really unpacked what could happen in terms of building capacity in that job role. And so we found like all these things that could be automated and centralized and standardized, that then built in like 40% capacity in that job. So that then relates to the fact that you're going to be able to reopen the clinics, most importantly, but also have really satisfied staff because we were listening. We were actively listening to the things that were frustrating them and some of the things that were just dumb about their job. So that makes a healthier work environment in terms of the satisfaction of the employee. That likely means you're going to retain them. And so there's that issue of retention. Then it obviously gets to this broader reality when you start to do that and simulate across 88 categories of jobs, for example, how that proliferates and how you make that entirety of your workforce happier. And then that relates to what are we actively listening then? Are we able to get all these different data sets and then do this broader look at the data and the integral components of the data to say, okay, well, let's do this in total rewards. Let's see what it looks like in total rewards and benefits. Let's keep going here. Let's don't just stop at job architecture and workforce optimization. Let's broaden this conversation to what is so important to your labor costs and your benefit costs, and make sure that your employees are happy there, because often we make these assumptions. We do employee surveys, again, low utilization, sometimes we don't find everything we need, but if we've got payroll, retirement, and employee surveys and all the things combining together, then we can get at the realities much more clearly. So that's the cool work.
Yeah, very cool. I mean, it seems like that would be really interesting to kind of run through that simulation of total rewards, thinking through benefit strategies going into the next year. And you're saying, okay, these are the different types of solutions that we're going to integrate. This is kind of the benefit plan design that we're working on, and really to kind of run it through those simulations and get those thoughts. I would think that that would change kind of that benefit strategy planning work that you guys are doing with employers dramatically. And then just think about how much better open enrollment I would think would go, and the uptick that you might want to see into certain benefits and that employee selection. So I could see that that could be extremely important for employers.
And because we've been able to do this using AI and just so much more automation, we can actually offer this as like we're investing in any of our people that we don't employers that we don't have today. So as we're looking at our prospects and we're going out there and having these conversations, we're saying, we'll do this for you complimentary because we want you to understand all the dynamics. We want to be better at predicting all these benefits that are going to be important to your people and the total reward. So we're at this point where with technology and data, it's all coming together to be effective finally.
Yeah. Yeah, that's exciting. That's very exciting. Well, this has been super illuminating, Wendy. As we wrap up, are there other things or any other topics that we did touch on that you'd like to say a little bit about in closing?
Yeah, I would say we've all got to just realize that we are partnered and interconnected. I'm talking about the vendor space, I'm talking about the consulting space, health systems and the healthcare delivery aspects, and employers. All this stuff has to work together. And I feel like we're finally getting some traction there. It feels good. I feel like there's a lot of negative in the world right now. Certainly, this is one of the positive aspects of where I think we can take it and go. It doesn't have to be doomsday. Let's make it an exercise of reality instead of frustration.
Yeah, I love that. I love that. So you're pretty positive looking into the future about just kind of where we can take things. And it does seem like there are a lot of new opportunities, as we were talking about, even like the innovations that have been out there that are maturing and the way that employers are thinking about that. And so I think I agree. I think it's an exciting time. I think change can be a positive thing. And hopefully that's what we're going to be seeing, going, through the rest of this year into next year as well.
Thanks, Lindsay. Great.
Awesome.
Fun to talk to you.
Very fun to talk to you too. Thanks, Wendy, for joining.